Hello everyone, good evening. So today I'll be taking a lecture on basics of exercise therapy. First we know what is exercise therapy. Exercise therapy is a type of rehabilitation that uses physical activity to help treat injuries or conditions. Okay, it's time of we use all the physical activities to treat various injuries and conditions. It can be used independently or with treatment like medication or surgery. So, exercise therapy, we can use it independently or we can use it with electrotherapy, medication, surgery, and other branches. So, let's start. Mechanical principles. So, in this lecture, I'll be covering total 8 topics, and all these topics are like important and sure to come in all the MPT entrance. So, if you have any doubt, you can ask me. The first is a linear force system or force, okay, force, then kinetics and kinematics, gravity, equilibrium, lever, pulley, axis plane, and muscle contraction. Okay, so these are the 8 topics that we'll discuss or cover here. So let's start. Force. Force is that which produces the motion or modifies the motion of an object and moves it in a particular distance. Okay, as it is clear from the definition, because it's very simple, anything that produces motion, जो एक movement लाए, ठीक है, और किसी movement को modify करे किसी object का, उसको बोलते हैं force. Like when you are playing, suppose you are playing football, when you kick the ball and ball moves in a particular direction, that's the force that you have applied. So you have changed the motion of the stationary ball. Okay, so it is a vector quantity. It's a vector quality. So it has magnitude and direction. Okay, there are two types of quality like scalar and vector. Vector has both magnitude and direction, and scalar only have magnitude. So force is equal to mass into acceleration, and it's so its SI unit will be kg meter per second square. Okay, and what is the unit of force? Newton and pound. Now, what is Newton? 1 Newton is defined as the force applied in 1 kg weight object and moves it by 1 meter distance. So, as per definition, Newton क्या है? Newton वो force है जो 1 kg weight को 1 meter distance तक move कर पाए. Okay? So, force may act on object in two ways. First is static and dynamic. Okay, so static means when the object is in rest, dynamic when object is in motion. So types of force acting on object. First is linear force. What is linear force? When two forces act along same line and produce the straight line motion, it is called linear force. Okay, so when the force produces the motion in a straight line, it's called linear force. Example, pushing linear force when two forces are acting on an object in same direction. Okay, then pulling when we push a door, when we pull a door. Okay, then equal magnitude or equilibrium when two forces are acting opposite to each other with the equal magnitude. For example, seesaw, when both the side same amount of force will be there, then what will happen? There will be equilibrium. Okay, so here with equal magnitude, equal forces acting. Then if unequal magnitude is there, then there will be a movement. and which occurs towards the greater magnitude. Now we'll see the example of linear force in our muscle action. Okay, as you can see here, psoas major and iliacus muscle act along the same action line, point of application and same direction. As you can see in the direction, psoas major and iliacus together they are called iliopsoas. These two. Okay, so they act along the same action line, same point of application, and same direction. So the resultant force equals the magnitude of two forces. So when two forces are combined, so their combination will form a magnitude, okay, which will be double the force applied. So weakness of one muscle will reduce the magnitude of the resultant force. So if out of these two, any one of the muscle is weak, there will be reduction in magnitude of the resultant force. Next is parallel force. Parallel force when two equal magnitude are acting in the same direction and same plane with the counter force in the middle. Okay, so when two equal magnitude act in the same direction and same plane with the counter force in the middle, it is called parallel force. Example, seesaw. The children are applying two forces in the end, and the fulcrum gives counter force to maintain the seesaw in neutral position. Okay, example in human body will be when the deltoid muscle contracts during shoulder abduction, the action of the anterior and posterior fibers of the muscles being compound to work with the middle fiber and so vastly increasing the power. So the basic simple example is of deltoid that I've given here. In deltoid muscles, what happens is that when we do shoulder abduction, there's action of anterior and posterior muscles. As you can see, when you do an abduction movement, what happens is anterior, okay, anterior and posterior fiber of the muscles, they will work together with middle fiber. So since deltoid has three fibers, so it will increase the power. Okay. So the next example that I have is hamstring muscles component, that is medial semitendinosus and semimembranosus and lateral biceps femoris. The medial and lateral forces act in the same direction to produce knee flexion. Okay, so see, in medial we have two muscles, lateral we have one muscles. Here, what happens is the forces act in the same direction. Then we have knee flexion. Okay, see, semimembranosus is here, semitendinosus is here. Okay, this muscle, and then we have biceps femoris, longer and shorted. Okay, they act in the same direction. So if the forces are equal to each other, the resultant is located in the middle, producing pure knee flexion. Okay. Next, rotational force. Here, what happened is that in parallel force, when first force is greater than the second force, rotation occurs. Two unequal forces acting at different points and in opposite direction produce rotation of the body. Okay. So suppose, see, this is a suppose this is a lever. Okay. One force is acting here, two forces are acting on the opposite side. Till the forces are equal, it will be in balance. But suppose if one side force is greater than the other side, then it will tilt to other side, okay? And there will be a rotational movement. Okay? For example, in human bodies, trapezius muscle and serratus anterior muscles, which contract to rotate the scapula with respect to body forces. And here, forces will be of two types: external force, that force arises from sources outside the body, example, gravity, and external device added to the body. Because gravity is an external force, it will come under the category of external force. Then body weight, cuffs, spring, pulley. Okay, and internal force will be mostly body's own structure, muscle, ligament, bone. Fine. So example here for rotational forces, deltoid muscles. Here anterior fibers flex arm, posterior fibers extend arm. Okay, and the combined action of anterior and posterior will abduct the arm. Fine. Next, uh, we'll move to our second topic, that is kinetics and kinematics. Now, what is kinetics? As you can see in the diagram, it is the study of forces that are acting on an object under a particular mechanism. Okay, so this is called kinetics. So, what does kinetic means? It is the area of biomechanics concerned with the forces producing motion or maintaining equilibrium. So, kinetics deals with the forces. Okay, so all the forces described as either external or internal. Forces will be either external or internal. I discussed in the previous slide, external forces are pushes or pulls on the body arises from sources outside the body. Okay, like gravity, then weight curves, dumbbells. Then internal forces are forces act on body arise from sources within human body. Example, muscles, bones. Now, what is kinematics? As you can see in the diagram, the branch of mechanics concerned with the motion of object without reference to the forces which causes the motion. So kinematics will deal with the motion of the object, not with the forces acting on it. Kinetics, forces, kinematics, motion. So kinetics is the area of biomechanics that include description of motion without regard to forces producing it. Types include types of motion, location of motion, direction of motion, and magnitude of motion. Okay, so we can divide kinetics into four categories: types, location, direction, and magnitude. Types. Now, types has some further classifications, which are rotatory motion, translatory motion, curvilinear motion, and general plane motion. What is rotatory motion? It is the movement of an object around a fixed axis in a curved path. Okay, each point on the object or segment moves to the same angle at the same distance. So in human body, the goal of most muscle appear to rotate the bony liver around a fixed axis. Okay. Next is translatory motion. It is the movement of an object in a straight line. Each point of the object moves to the same distance at the same time in the parallel path. Okay. It's a translatory motion. Got it? Then curvilinear motion, both rotatory and translatory motion combine to produce this motion. It is the most common form of motion produced by human joints. The last is general plane motion. Here the object is segmented and free to move. Next category is location of motion. Here, motion at a joint may occur in transverse, frontal, sagittal plane. So we'll cover this in our axis and plane part. Okay. Next, direction of the movement. Movement may occur either in clockwise or anti-clockwise direction. Okay. Like flexion and extension generally occurs in sagittal plane around the coronal axis. Okay. And flexion refers to rotation of one or both bony liver around a joint axis to those ventral surface are being approximated. The rotation in the same plane in the opposite direction is termed as extension. Okay. So assembly in same way we'll describe abduction and adduction, which occur in frontal plane around an anterior posterior axis. Abduction is rotation of one or both segments of a joint around an axis so that the distal segment moves away from the middle line. Okay? And in adduction, in the same plane but in opposite direction. Then rotation. Rotation occurs in horizontal plane around the vertical axis. Medial rotation, refers to rotation towards the body midline and lateral to the opposite. So it's simple, like normally shoulder flexion, okay, this forward movement, it occurs in sagittal plane and coronal axis. Fine. Same extension, it will go back. Abduction, going away from the body. Okay. And you from neutral, if you go away from body, abduction. Okay? And if you come towards the body, it is adduction. Then if you go out, external rotation, internal rotation. Okay, which is in vertical axis and horizontal plane. Then we have magnitude of motion. It can be either in degrees or radians. 1 radian is equal to 57.3 degree, and 1 degree is equal to 0.01745 radians. So for this, mostly we use goniometer. Then our third topic is gravity. So what is gravity? Gravity is the force by which a planet or other body draws object towards the center. Okay. So if you throw any object in the sky, suppose a ball, it will come down. And that force which is pulling the ball towards the ground, it's called gravity. The force by which all the body are attracted to Earth is gravity. Now in gravity segment, we'll cover center of gravity. What is center of gravity? COG is an imaginary point at which the mass of object is concentrated. Okay. As you can see, this point is dot. It is the center of gravity of the person. So when one is standing, it's here. When extended, it goes up. And when you bend forward, center of gravity is at this point. Okay. So COG depends on the size, shape, structure, height, and position of the particular object. In symmetrical objects, COG located at center of object. Okay. For example, a ball or a square box. And an asymmetrical object, COG located at heavier end. Then LOG. LOG means line of gravity. Now, what is line of gravity? It is an imaginary vertical line passing through the COG, and it's called LOG. See, this is COG, and the line passing vertically, LOG. Okay? This is stable and this is unstable. His center of gravity is here since he is bent forward, and this one is the line of gravity. Okay? So when the human body is in standing position, the line of gravity passes from the vertex to the second sacral vertebra to just in front of the ankle joint and between the feet. So which structure the line of gravity passes? First, the vertex, top of head. Second, sacral vertebra in sacrum area. And then just in front of the ankle joint and between the feet. Okay. Next is base of support or BOS. The base of support means the area supported beneath the object. As you can see, if you stand with both the feet closed, this will be your base of support. If you stand with wide feet, it will be your base of support. Okay. So base of support means the area supported beneath the object. If base of support is more, the stability will be more. So you can also, when you stand like this, you might also feel that you are shaking, you're going to fall down easily. But when you stand with a wider width, step width, or stride width, then what happens is you have a larger base of support. So you are more stable in this position than this position. If base of support is more, the stability will be more. Okay, since your base of support is more, stability will be more here. So base of support is inversely proportional to center of gravity. What does it means? It means that, see, when base of support is small, COG is higher. When base of support is more, COG is less or at lower. Okay, so lesser the COG or more the COG in front of the ground, then more the stability. And if COG has more distance from the ground, it means less stability. Okay, and stability is directly proportional to BOS. It's simple. More base of support you have, more stability you have. Less base of support, less stability. Okay, in line position, the posterior aspect of the whole body forms the base. In straight standing, it is an area as wide as the pit. And the fundamental position of standing, the BOS is lesser than the line. Okay. And then, so COG in standing position is in the higher level, whereas in line posture. Then D, last one for the day, is equilibrium. Hope till this everything is clear. If you're getting any problem, like if I'm fast or anything, you can just tell me. Okay, fine then. Then what is equilibrium? Equilibrium is a state when the forces acting upon a body are perfectly balanced and the body segment is at rest. Okay, this is the object in equilibrium because moment of force is equal to counter force. So clockwise movement or forces will equal to counterclockwise moment or forces. Okay, it is the state of an object where all the force acting on it are equal in magnitude and opposite in direction. Okay, hope you got it. What happened in equilibrium is the clockwise moment of force is equal to counterclockwise moment of force. So the forces acting will be equal in magnitude and equal in direction. So types of equilibrium: stable, where two forces acting on an object are equal. Example, book placed on the table, the base of support is more and COG lies to the lower part. Okay, here we can see in this cone, the base of support is wider than all the three. Okay, and COG lies closer to the base. And then same here, example of book, unstable equilibrium. Next is unstable equilibrium. Here, when two forces acting on an object are unequal. Okay, one force is greater than the other force. For example, pen is balanced to stand on the floor. Okay, pen is balanced, but when force is applied on the pen, it alters the original state. Okay, if you push slightly, it will alter and will fall down. What happens is when BOS is less and COG is high, COG is in higher position. So as you can see here, in comparison to book, the base of support is very less, COG is higher. So even a slight application of force, it will make it fall down. So this is unstable equilibrium. And next is neutral equilibrium, when the movement or position changes in the object by force exerted on it. There will not be any change in COG of the object, example, ball rolling on the floor. Okay. Suppose this is the ball which is rolling on the floor. When you apply force, see, COG will always be in the center of the ball. So it will be in neutral equilibrium. So if you see body, how it affects is stable state. This diagram. It's stable state of equilibrium. So projection of center of mass falls inside the base of support. You can see when we are walking, center of mass is inside the base of support. So what happens here? It will be stable equilibrium. Then metastable state of equilibrium. Here projection of the center of mass moves towards the boundaries and briefly even beyond the boundary. Okay. For example, in running, when you're running or sprinting, okay, here's the center of mass. It moves towards the boundary and even beyond the boundary. Okay, so this area. So during running, transition from stance to flight phase, the body is in a continuous state of falling, recovering because COM is outside the base of support. Then unstable equilibrium. So projection of center of mass falls on the boundary of BOS. Okay, and a stable and or metastable state cannot be regained. So suppose when we slip in a floor or stairs, what happens? This COM is projected on the boundary of base of support. It's neither in between base of support, okay, nor on the boundary. It's just outside the boundary. So that's why one falls down. So one more point along with this are fixation and stabilization. So what is fixation? Fixation is a state of immobility, and stabilization is the state of relative immobility. Okay. Activation, active fixation of joint is obtained by co-combination of muscles, and passive fixation by manual pressure straps. Like when we are going to do some mobilization or anything, first you have to stabilize a part. We're told to stabilize. Okay. So in stabilization, the state of relative, there will be relative immobility, and in fixation, there will be a total immobility. So fixation are of two types: active fixation and passive fixation. Active fixation of joints obtained by combination of muscle, which we fix by ourselves only, and passive fixation with manual straps and then sandbags. Okay, so this is it for today. Since we have total 8 topics, so I covered 4 of them. I hope it was helpful to you. Okay. So I'll be uploading this video soon. So do like the video and subscribe our channel, and we'll be posting more such lectures soon.